Hello, and welcome to POMA Does, a podcast produced by the Pennsylvania Osteopathic Medical Association. We provide a voice for osteopathic medicine and share insights on issues important to osteopathic physicians, residents, and students, as well as those who embrace the osteopathic philosophy. POMA's mission is to promote the distinctive philosophy and practice of osteopathic medicine in Pennsylvania for our members and their patients. Thanks for tuning in.
Hi, this is Joe Zawissa, and I'm the immediate past president of the Pennsylvania Osteopathic Medical Association. 2022 was a very special year to me for a lot of reasons. For one thing, I completed my year as the president of the POMA. I worked really hard, and it was an honor and a privilege to serve as your president. But I also worked really hard to get to that point. And so it was a nice change to be able to hand over the reins to Dr. Lisa Witherite-Rigg earlier this year. We got a lot accomplished. For one thing, I got to oversee the return of in-person meetings. That was a great feeling after a few years of isolation, as I'm sure you can all agree with. We moved around the state and saw places that we wouldn't normally see, and showed our members that POMA is more than just an organization that meets in Harrisburg a few times a year. It was really nice to see the fruits of some of the labors that we put into the last year too. One of my biggest accomplishments is the podcast series that you're listening to right now. For something that we were still working out the kinks on just 15 months ago to be as successful as it has been, I'm really proud of that. We started with our first episode in January, and I was honored to be the first guest. I talked about POMA, what it does for our members, what members can do for POMA, a little bit about my presidential year, and what else I had hoped to accomplish. And now you're listening to episode number 24. For something that we were just getting off the ground a year ago, it's really exciting that we've come this far. And by the way, episodes 25 through 28 are well underway. So I hope you'll enjoy them, and I hope you've enjoyed this series as much as I have enjoyed making it. After I completed my presidential year, I joined the State Board of Osteopathic Medicine, and I'm hoping to serve my fellow DOs well in that capacity too. But all of these accomplishments take second fiddle to the greatest memory I'll have of 2022. 10 years ago, I joined my father in his private practice, Michael Zawissa, DO, and for the last 10 years, I've gotten to work with him every day at his office. At one point, we traded positions and he actually started working for me. I got to tell you, that's an unusual feeling. This year, though, after 34 years of serving his community as an osteopathic physician, Dad was ready to retire. It was a bittersweet transition for me. Of course, I'm thrilled to see my dad enjoy his retirement. He deserves it. But he, along with my mom, still are my greatest mentors, and I miss going to work with him every day. It's been a little tougher without him, but knowing that he's enjoying his well-earned retirement makes it worth it. And perhaps one of the greatest compliments I get is when a patient tells me, "You're just like your dad." Dad's patients really loved him. And so for them to say something like that to me and let me know that the transition has been pretty smooth, it's a great honor. So like I said, 2022 will be a very special year to me for a lot of reasons. I know many of you probably didn't have that same honor to be able to work with your dad like that for 10 years. Or a parent like that for 10 years. I can tell you, it's as wonderful as it sounds. I'll miss working with you, Dad. So with that, Merry Christmas to all of you and a Happy New Year, Happy Holidays, however you celebrate. Thank you for listening.
Hi, I'm Darlene Antonet, General Practitioner in Old Forge, Pennsylvania. It has been a very interesting year for all of us. As the pandemic progressed, many physicians closed their offices and went to an all-virtual contact. Since over the years, I have been exposed to Legionnaire's disease, HIV, hepatitis, atypical pneumonia, and every childhood disease that walks into a general practice. It was a choice to practice PPE and remain open, with all my staff in agreement. My patients had a choice, and many of them needed that osteopathic touch. Limited access to testing made hands-on even more important for proper clinical diagnosis. I was surprised by one patient who mentioned that I look like a real doctor wearing scrubs rather than my Talbot suit that I really enjoyed wearing. Another patient called me a dinosaur, making house calls, hospital visits, nursing home visits, all during these difficult times. I started this profession with intentions to render care where it was necessary, and the pandemic was pushing medical care on the back burner. with the fear of COVID-19. We all have had close family and friends affected by COVID-19, and it has changed the medical focus in many ways. The year has been interesting for medicine, with all insurance carriers now auditing more than usual to get their numbers, patients trying to catch up with their missed mammograms and colonoscopies and cataract surgeries. It is time to resume care as it was, not a new normal, but back to the basics. The biggest change for me this pandemic will be to keep the scrubs, since it makes me look like a real doctor, and I will not go extinct. And like one of my patients gave me for Christmas, the end.
My name is Catherine Graham. I graduated medical school from Lee Comet Seton Hill in 2013 and internal medicine residency in 2018. Every time I reflect back on my time as an attending, I am considerably astounded at how fast things have moved, and that it has been 5 years since I graduated residency, which in fact it really feels like it has been much less than that. Every time around this year, we all become increasingly reflective about the past year, and I would be remiss if I didn't exclaim or bring up that my favorite part of my professional time this past year was receiving and giving the keynote speech at the Lee Comet Seton Hill White Coat ceremony. It was very nice to be standing elbow to elbow with the student provost of Lee Comet as well as the POMA president, and it was very refreshing to see a new class of medical students embarking on their journey as an osteopathic physician.
During this holiday season, we think back about many of the patients who've left an impression on us, and I wanted to tell you about one such patient. My wife and I are family physicians in Bristol. Many of our patients walk to our office, and we live in town, so it's not uncommon for someone to show up at our door. One of our 92-year-old Italian ladies used to show up at our door around Christmas time with lasagna. She would walk the several blocks from her house just to deliver it to our door. These lasagnas had to weigh at least 10 pounds. They were very good, and we appreciated her doing this. She would not even allow us to give her a ride home when she delivered these. We're going to miss her. She passed this year along with her sister, but her memory will stay with us for a long time to come. Have a happy holiday.
Good morning. This is a story of resilience and trust. I met this patient at least 2 decades ago. She came in with chronic pain. She's a mom, a grandmom, a friend, very active in her community, and loves Disney. She could not do any of those things. First, I listened, and we worked her up, and she was diagnosed with, at that time, the verbiage was a reflex sympathetic dystrophy. She was sent to the city for state-of-the-art, city of Philadelphia for state-of-the-art treatment at that time, and she was able to, with those modalities, oral medication, physical therapy, some spiritual also modalities, have a really full life. Because of aging, some mishaps, other diagnoses, the requiring for surgeries, every setback medically will result in a flare that she was able to move through. However, with the changes in the milieu economically, with medicine availability, with institutions closing, doctors moving away, that community, that medical community of trust that she and I built together within our small community and the medical community at large started to falter. She started to have doubts, and still resilient. And then with the opioid crisis, because the opioids are part of her regimen, suddenly she became someone that was looked at with question. Every time she had to make some kind of a change because of a surgery, where she would then go from her home to an assisted living to a different acute care facility, there were all the questions and the doubting of her pain. And suddenly she had no one to trust except her core people. And yet she was always doing everything she was asked to do. She continued to do her non-pharmacologic therapies. She continued to do her spiritual practices to maintain her resilience, and she has a strong community, again, as a mom, a grandmom, friendships, and within her community at large. And her resiliency has maintained her faith, if not in our system, in the individuals who she directly comes in contact with. And so I am honoring this patient who, despite the challenges of healthcare today, has remained optimistic through the joys of being pain managed, the challenges when it's not managed well, and trusting that with the help of those around her, she will get what she needs. Thank you.
Hi there. To be honest, when I retired a little over 2 years ago, I wasn't sure how I was going to handle not having the daily patient interaction. Then I had to remember my why. Why did I become a doctor? Or why was I called to be a doctor? And then I remembered the what. What do I love? What do I love about being an osteopathic family physician? I love being part of people's lives. I love learning about new things, putting the puzzle pieces together, figuring things out, and then sharing that information with patients and families. So together we can come up with a good plan that's right for them. Everybody that knows me and loves me, when they heard I was retiring, said, "Lisa, what are you going to do?" My patients said, "Lisa, what are you going to do?" My family, my colleagues, my coworkers, they weren't sure what I was going to do. Even my therapist said, "Lisa, how are you going to reinvent yourself?" And I go back to the why. About 3 months after I retired, my brother Ricky got the call. A man had died, and his family unselfishly gifted him new lungs. Ricky underwent a lung transplant, double lung transplant, in January of 2021. It was during COVID. We couldn't be there with him, but we were there. We were sitting on the sidewalk outside of his room of Shady Side on the days that he had a window, looking up at him with field glasses and talking on the phone. I learned a lot about transplants and studied about anti-rejection drugs, and then I had to learn about ECMO and study more about subdural hematomas, and I know more about opportunistic infections than I care to know. My brother died in June of 2021, but I was able to be there. And then in August of 2021, my sister Marla was diagnosed with breast cancer for the second time. 5 surgeries later, and pretty much every complication that could have happened. I was able to be there. She's doing well. She still has a few more surgeries ahead of her. We still drive back and forth to Pittsburgh, but every now and then I get to spend that 2-hour drive with her each way. And I wouldn't trade that for the world. And I get to ask her specialists the hard questions. And every now and then I get to scrub her kitchen floor when she can't do it herself, just like our mom did for us. She's doing good, and I'm able to be there. And then in July of this year, my brother Mark got COVID. A couple months later, he wasn't doing so well, went to the emergency room, and he was misdiagnosed as having congestive heart failure. He shared with me his studies from the ER, and I looked at him, and we talked. And I said, "Mark, this isn't your heart, it's your kidneys." I went with him to the specialist. They scheduled him to see a cardiologist, certain it was his heart. Talked to the nurse practitioner that saw him and said, he has nephrotic syndrome. And indeed, my brother Mark had the rare COVID kidney with a 30% chance of recovering to not need dialysis. I watched a miracle happen. As a family, we studied. We were able to explain things to each other. I went to the hospital with him. I went to his doctor's appointments with him. So you see, my why and my what I love about medicine didn't really change all that much. It's the who I got to share it with, the people that are most important to me. So for those of you who celebrate, look back and remember your why, know your what, but always remember your who. Have a blessed holiday, a happy Hanukkah, a Merry, Merry Christmas. My favorite memory of 2022 is remembering my why and not having to worry about what's in my cup.
Thank you for joining us for this edition of POMA Does. Be sure to subscribe to POMA Does wherever you listen to your podcasts and tell your friends and colleagues to tune in. Learn more about osteopathic medicine and POMA on our webpage, www.poma.org, and join the conversation on social media. We're on Facebook, Instagram, LinkedIn, Twitter, and YouTube, or email us at poma@poma.org. We'd love to hear from you. Join us next time for another edition of POMA Does.